Well, good afternoon, everyone. Hello. No worries. I
Package. Like 7 minutes for an elevator. Oh, self-timing. So we're ready to start. Anybody else get stuck on the elevators today? Not just me. Misery loves company. Welcome everyone to this rapid fire session, Decolonizing Healthcare and Improving Quality with Indigenous Teachings. We're all in the right room. I just want to start off with so much gratitude and acknowledgement of the traditional territory that we're on, Coast Salish territory, nations of Musqueam, Squamish, and Tsleil-Waututh that are hosting us today to do this good work and connect with one another. My name is Megan and I work with First Nations Health Authority. I'm just going to introduce the first group and not waste anybody's time and let everybody else introduce themselves. And I'm going to be sitting over there with a timer, making sure we have time for everybody that's speaking today. So 10 minutes for presentation and then a chance for you to ask any questions that you might have. Please fill out your evaluation forms. They're so important to the council and how they plan for next year's session. So every year it just keeps getting better and better. So I'm just going to welcome Grace Kelly to talk about Caring Teachings Model, Indigenous Teachings for Healthcare Professionals to Support the Stages of Life.
Eastwale, Clacy Telsqui, Talitsa Kwathawali, Casta Haklip. My family roots are from Swali First Nations and Haklip from Fountain First Nations, where my mom is from. I'm also proud to be Chilliwack, part of the Chilliwack territory. Very blessed and honored to be in presence of some wonderful people here with the Quality Forum, and really appreciate being able to offer some Indigenous teachings that are very important to me in my work, and also the communities that I represent, and the Chilliwack Division of Family Practice and Fraser Health, who I connect and work with. So I have nothing to disclose. So thank you for doing the traditional territory acknowledgement. I often get asked as to the purpose or some reasoning or just some teachings, and I believe this is probably my perspective of the importance of the Indigenous teachings. I often say in gratitude, you might see people put both their hands up. We say we are in appreciation to our ancestors for creating this safe place for us to be in, creating this safe opportunity to build, work, and play on in the communities or organizations that we work with. So in continuation of that, what it is that we want to think of for the present and then also for the future. So I hold up my hands for my children, my children's children, and their children to continue to have this safe space to live and work and play on. It's so important to continue to developing and integrating the awareness of community connections, community engagement, and also being ensured that we are knowledgeable of the lands that are around us and or the lands that were existing before in traditional territory. This is near and dear to my heart in creating the 7 caring teachings. This is a foundation of the cultural safety and humility framework that I created to support the primary care work within the Chilliwack Division and Fraser Health, connecting with the 22 communities from Boothroyd to Chilliwack. I take this in gratitude and honor to share these because it's all about creating that ancestral teachings of how we cared for people previously. We may know of the 7 grandfather teachings, the laws of life. I decided to create that health and wellness perspective and calling it the caring teachings. Communities are so appreciative that this work is being developed and integrated into all the work I do in connecting with the healthcare professionals. What it is, it creates that cultural presence and identity. from an Indigenous perspective, from an Indigenous voice. It's so important to continue what we see as a lifelong learning journey. It's not a checkbox, it's something to build up on the values and relating the importance of the 7 caring teachings and how it is to Indigenous. Here we have this wonderful, how it's connected with the model. I have the 7 caring teachings in the middle. We talk about first having that opportunity to set, to really believe that this is of importance and taking those next steps. So set is our Halkamalan word for we believe. In sharing of the words of the 7 caring teachings, listening, supporting, sharing, trust, helping, goes down to a really, really important word of healing as we're learning and living through what is living trauma. We have to come into that understanding that we are here to be with each other, to support each other, to build up our resources and network. With that is, what is that common approach? And that is the 7 stages of life. I have identified it in these categories. These are categories that I see that fit with my work that I do, but others may develop this within their own organizations or health agencies. We look at the words of Every Child Matters. It really encompasses the needs of those people within those stages of life, and how could we bring forth those teachings. Fortunate to also have the opportunity to build up on what is traditional wellness practices, living off the land, holistic teachings, healing circles, smudging, connection with elders, sharing with teachings that are of value that need to continue to pass on, and incorporating that as the language as well. It's really important to always ensure we're learning from everyone and continuing that journey. It's not a place where you just kind of learn a little bit and put it away. It's more than a sanyas, it's more than foundation training, it's more than informal training. It's all about continuing on with those discussions in what we like to learn as well, but also developing new tools and sharing those tools. Because if you don't share the tools, then how do you know you learned? So it's really, really important to always keep ensuring that that value is ongoing. I like these words of the lifelong learning continues, the journey continues. We don't want to forget, we want to build up on. So the foundation here is the 7 caring teachings. We also want to ensure the medicine wheel teachings. Here I describe them as body, mind, spirit, and emotion. In our Halkamalan words, it's Letsamat, Letsathala. So when we network with Indigenous, it's all about bringing that balance. How do we do that? It might be bringing a little bit of nature in, might be offering some holistic teachings, might be offering some guidance from some elders to network. Don't be afraid to make those connections. They will welcome you because they're honorable to share those words that they have been passed through generations and through their ancestral teachings. Here we have some wonderful work. I'm proud to say we're in this new building out in Chilliwack. This is how we're doing it. This is how we're integrating cultural teachings and awareness. Mama Iethtal out means helping one another. Evans Road, it's a public community primary care center. We have some beautiful artwork, but it's more than just artwork. It's identifying the stories of the artists as they have learned from their ancestors, their teachers, to bring forth their designs. It's really important to identify, once again, it's awareness of story, right? That's coming through all of this wonderful work. Fortunate to also incorporate in our wonderful sacred space room, Shwiath out. These beautiful designs encompass how we can be in good health, how we network with each other and develop that awareness of what is health, what is healing, what is caring. We have a wonderful mentor within our group. Her name is Muriel Victor. She's a traditional plant expert. She's also a herbalist. So in addition to offering some assistance in our sacred space by connecting with Indigenous, offering awareness and tools to staff, it's also taking plant walks, being knowledgeable of what's in the community so we can take those special ingredients through the Silalam, the seasons of the year, and create those stories of sharing and learning from each other. It's just such a valuable resource to develop and continue, because once again, we don't all know one thing. We all have to share what it is. So working through the seasons also creates that awareness. If we didn't share and create this awareness, where would we be? So it's opening the doors to all the special gifts in the communities as to where they are and what they would like to achieve. With our communities now, it's a lot of learning of land-based teachings. It's holistic teachings. It's continuing on with the drumming and singing. It's getting in touch with Mother Nature, Sothtumach, to bring us that balance of body, mind, spirit. This is a really, really important slide. This is a really important picture. Laura Wheelock created this picture for me, and it's all about creating where we are as far as cultural safety and humility. Every heart matters as Heek Makwat Thala, and I sit, I wait, I wonder. Imatsil, Katsil, Tatilsil. So when we're learning and building up our cultural safety and humility, this is what we want to capture. We want to capture those moments, those aha moments, those moments where we can learn and build and share, because it's all about learning with each other, sharing with each other, sitting and waiting and wondering what else are we going to accomplish. Because it's all about that awareness of self. It's awareness of the surroundings, the community surroundings, the engagement, and it's also about how do we apply that within our workplace. I have to share, in the beginning I wanted to share, but I will now. I am the first generation that has not attended residential school. It's something really big to think about. So that's why I wanted to add it to this slide. My grandparents and my parents were the first and second. So I'm the first who didn't have to, me and my sisters. That's a really important thought to think about as we're learning together and developing awareness of the residential school era. Let's just continue to learn and be proud of all of our work that we're doing together to heal and to build and to create awareness. I'm really proud to be here to share, but I'm also proud to acknowledge all of the mentors that have been before me to bring me to where I am today. Lots of wonderful resources that are out there, and it's just a matter of connecting more and building up and seeking those answers and finding the right people to do that. Don't be afraid to reach out, if anything, from today, if that's what you can accomplish. The 7 caring teachings, the 7 stages of life, and this, that every heart matters. I'll be open now to any questions if anybody has anything.
Thank you. That was a privilege to hear you speak and to share those that progress and the work you're doing. Could you expand a little bit or share a little bit about the concept of listening with 3 ears That's something that struck me.
I could even tie that in a little bit with the 7 stages of life. So we have the birth and the infant. So we take home the umbilical cord, and we make that request, when the baby's born, and we take that home with us and we plant it in our family's yard or in our community. And it's really listening to what it is that Indigenous teaching that we would like to continue. It's listening to ensure that we're not just handing something over and doing it, but we're doing it with respect. And listening before we make judgment, before we have any kind of foundational thought of maybe how to express a question or how to answer back, or it's really is making sure that we're doing our due diligence to be respectful in that communication, engagement, and strategy. It's just so funny because when I have my 3 children and I've planted their umbilical cords and they don't know where it is, but they go to those spots. So isn't that so? And they are also, I think, listening as well. So they're listening to their ancestors that are telling them, you're here now, get some balance, you're home, your family's still around you. Yeah.
So I'm familiar with Every Child Matters, but this is Every Heart Matters. Do you want to just speak a little bit about that and the significance of I sit, I wait, I wonder for us? That would be awesome.
Once again, it's connecting with the 7 caring teachings. I'm very, very creative. I just kept thinking, what is it that I want to really capture? What it is that I want really people to think. So this is really about every person, taking care of everyone's needs. It's also ensuring, we have this circle that we're very familiar with to ensure we're not forgetting that we're all in this together to live, work, and play on. Just being respectful of all the voices. And here we have a variety of people, so they could be whoever you would like it to be. So an elder, a child, or a friend, that connection who may bring you that resource or that support in time of need. And also ensuring, as we do our work on a daily basis, to take care of ourselves. We take care of ourselves, we take care of our heart, so we can do that in a good way.
Masicho.
Hi everybody. Today we're going to share with you an Indigenous community-led approach to cultural safety education that seeks to decolonize the healthcare system through making and dialogue. This is a 3-year collaboration between Emily Carr University and the College of New Caledonia. This is a clicker. Okay. We want to disclose that this project is funded by the Vancouver Foundation through a systems change grant. So one of the unique aspects of the work that we're going to talk about today is that it's an approach to cultural safety education for healthcare students and healthcare practitioners, but it emerges through the work and practice of an Indigenous and a design team from Emily Carr University in close collaboration with the College of New Caledonia. We're led by Marlene Erickson, who's the Executive Director of Aboriginal Programs at CNC, and Brenda Crabtree, who's the Director of Aboriginal Programs at Emily Carr and Special Advisor to the President on Indigenous Initiatives. We have a really big team that we couldn't all get into this room today, but we have some really critical members who all contribute to the work in really diverse and significant ways. We have an elder, we have Indigenous artists, we have designers, we have a non-Indigenous family physician, and an Indigenous nurse who's also part of this group. I'm Caylee. I'm the director of the Health Design Lab at Emily Carr University. I'm a settler of Eastern European descent, working and living on the Musqueam, Squamish, and Tsleil-Waututh territory, along with the rest of our Emily Carr team.
Hi, I'm Nadia Bezai, and I'm the coordinator at the Health Design Lab working at Emily Carr, and my ancestry is Middle Eastern and South Asian.
Anine, my name is Zoe Laycock. I'm an Anishinaabe Métis. I'm a recent graduate of Emily Carr and going into the MFA program, and I'm a research assistant on this project.
Our team started this work more than 3 years ago with an idea of how art and material practice could foster cultural safety, and the sort of purpose and intention behind this work has really only been further validated by the In Plain Sight report that was published last year. So as noted in that report, current education and training programs are inadequate to address Indigenous specific racism in healthcare. Indigenous healthcare statistics continue to highlight marginalization, inequities, and disparity in healthcare for Indigenous people. So clearly something is lacking, and we need to extend the learning of healthcare practitioners to include the pillars of cultural competency. But more importantly, we have to recognize the limitations of classrooms and clinical practice in teaching those pillars, and we need to find methods to help move healthcare providers to a place where they can integrate these things into their practice. And so we need culturally relevant strategies and learning tools to improve cultural safety within healthcare.
Having participated in and observed other cultural safety education programs, our team saw an opportunity to develop an approach that was more relational, community-based, and culturally immersive. Currently, most cultural safety education programs are developed specifically for healthcare practitioners or students. So we decided to create a program that would bring healthcare students and Indigenous people together as co-participants for the purpose of shared learning in mutual benefit. Key to the workshop experience has been the inclusion of local artists, as Caylee mentioned, knowledge holders, and cultural advisors. In this case, we partnered with the College of New Caledonia, so that was the Caylee-Tenay region. Oh. Green one. Our workshop model includes a 2.5-day workshop for approximately 20 participants, where we strive for an equal contribution and distribution between Indigenous community members and healthcare providers. The workshop follows a loose, structured agenda that relies heavily on the makeup of who we bring into the room to facilitate rich and meaningful dialogue and the sharing of experiences. The workshop is less of a teacher-student model and more of a community coming together. As for the workshops themselves, the general rhythm for each of the 3 days is convening, a diverse group of people coming together in a shared space, a sharing circle, which is an opportunity for learning, unlearning, and active listening and sharing. Resting, a chance to digest what was happening through intentional breaks in the programming, shared over lunch, as also through the making as well, which is an embodied experience of reaching a level of connection through cultural practices and material practice through shared experience, and reflecting, which happened throughout the workshop, but also an opportunity to extend that learning beyond the workshop, as some of the making activities were intentionally meant to be not completed in that session and allowed for an opportunity to extend that, share it with community members and others after the workshop. So we started the workshop with a Brave Space Agreement. It was an entry point and understanding into Indigenous-led mechanisms. Sharing circles are inherently intended to be brave spaces, and other Indigenous protocols have built in layers of respect. We've tried to enable students to connect with real community members to hear everyday stories and experiences. So far, we found that this has really helped to break down the prejudices and views of racism. It's not by clicking through an online course or sitting with someone reading through historical facts. It's about creating safer spaces and brave spaces to have those difficult conversations.
Our days began with listening to knowledge holders, elders, and respected Indigenous leaders from the community who have really deep understanding of Indigenous history, culture, making, and lived experience. This facilitated a direct connection to local Indigenous culture and community. Knowledge holders laid a foundation of learning that we could reflect on and build off of in our sharing circles and discussions throughout the weekend. Our knowledge holders introduce important historic contexts and how Indigenous people and communities are still impacted today. The workshops create space for participants to share and learn from one another. Specifically, sharing circles created structured spaces where participants felt safe and welcome to be open and vulnerable, and brave enough to share their emotional response with the group. Learning came from hearing each other's lived experiences and perspectives. It's one thing to read about racism and abuse. It's another thing to listen to a fellow group member talk about how racism has impacted their life. These stories showed us how the impacts of residential schools are very much still a part of the current lived experiences of Indigenous people today. Through sharing personal stories and the shift between talking and making, the workshops create a space for reflections on allyship and advocacy, courage and authenticity, and learning through embodied experience. In other seminars, people listen and then go away. They don't build a community or deeper understanding through connections. For ours, the making facilitates the sense of community amongst those involved. Making offered participants both space to rest and reflect on the sharing circle. Balancing making, rest, reflection, structured and unstructured conversations creates necessary conditions for introspection, learning, unlearning, and healing. Making creates an environment that stimulates dialogue. While making, participants connect and learn from Indigenous artists and their peers through formal and informal conversations. Making offers tangible connections to land and traditional Indigenous practices and knowledge holders in their communities. One of the participants expressed that they felt really relaxed, quote, "When I was making, the anxiety from the tough conversations was being let out through the making. Starting the day with serious discussions in the sharing circles, and then during the making, I was thinking about what we were making, what ancestors used these things for, and how to connect to the materials and items we've made." Each day involved making taught by several local artists. We worked on many projects, each specifically chosen to match the pacing, mood, and conversations of each day. The projects were not meant to be completed in the workshop. They are meant to connect participants with making and each other and through conversation. The making is also a key element which benefits Indigenous participants. One participant said they gifted their drum to their dad. He was so happy and proud. "You made this?" For my dad to talk is hard, and he opened up when I gave him the drum, told me to talk to Grandma while she's still here. Making creates an opportunity for many participants to connect with their culture and to material practice resources that are hard to access, particularly in smaller communities. Drum making takes a tenacity that exhausts your body and yet brought out the best laughter and stories. There was relief and pride. When participants finished their drum that brought everyone together, reminding us that one of our integral Indigenous teachings, we are all one. A nursing student said, "Doing the drum making ourselves is a whole new aspect because you learn it's not just about cultural safety, but by participating in it, you're learning cultural safety in a different way. It's not just hearing about it, you're doing it."
So through feedback and interviews with participants, we've run the workshop 4 times now, we understand that the workshop impacts participant learning in supportive and relational ways. The workshop provides a culturally immersive experience that shifts away from a deficit-based perspective of Indigenous culture. Indigenous participants are not limited to sharing stories about trauma, but they're able to share a spectrum of themselves and their stories as present, as embedded, and engaged members of their nations and their communities. Participants expressed an understanding of not just the systemic impacts of racism within healthcare settings, but also where they sit within those systems and how they might be able to see themselves and they see their practice as being able to be part of that change. Now, we wanted to conclude, we are missing our leaders today, and we wanted to conclude by sharing a few words by Marlene Erickson, who's the project leader at the College of New Caledonia. So I think we're going to just attempt to play her audio because the video is not working, so we hope you can hear this.
In conclusion, we're very excited about the positive outcomes of this great teaching. It demonstrates how building relationships is foundational to changing attitudes and building networks of support. And these key teachings are not being taught and really can't be taught in most classrooms. Further, it draws on local knowledge holders, so there's no shortage of expertise, especially when you consider that most specialist care requires rural to urban travel. It's important for health professionals in these regional and urban centers to foster relationships and give the parents the courage to reach out and build those relationships and supports when they get home. Cultural competency, or as our elders call it, gentle hands, is a critical component of improving the health outcomes of Indigenous peoples, probably as important as the medical knowledge students learn. And we hope workshops like this one will instill those skills so the participants will carry them into their professional practice and beyond. Thank all of you. You have honored us.
So we've piloted this workshop model 4 times over the last 3 years. We're holding a 6-week exhibit at the Two Rivers Gallery in Prince George this summer, as well as creating a publication to help disseminate this model. And we're now really interested to look at how can we bring this model and this approach to other communities, other healthcare contexts. So if people are interested, please feel free to reach out to us. But we'll conclude there. Thank you.
Thank you for sharing this with us. I love everything about this. I love the learning by doing aspect. I think that's wonderful. I was just curious, is the workshop co-facilitated by an Indigenous community member and a healthcare worker, or who facilitates the workshop?
Yeah, so I don't know, can we go back? Maybe not. There are about 10 of us facilitating the workshop and in that room. So it's really a big part of the workshop experience is who else is in the room helping to make that experience happen. And so in that room has been, Indigenous leaders, Indigenous artists, local elders. We have had, we recruited an Indigenous nursing student who participated in one of the first workshops. She now helps co-facilitate it. We have a non-Indigenous family physician who's there. So we're really mindful about who we're bringing into the room in addition to the participants and how those voices really contribute to that whole experience.
Yeah, I think this idea of like ratios and who's involved in the team was core to kind of even as thinking about how do we run this workshop. And I think people have approached us of, oh, how do you scale this? And does your team hop around and, replicate this elsewhere? And I think core to the model is really building community with building local community connections, and so that you can't just pick up and go. It's about establishing that, and that takes time, and then thinking how can you then potentially work on a workshop together that builds capacity, includes the artists, creates a sense of collective locally.
Thank you for the wonderful work that you're doing, building the connections. Is there any intention for the participants in the workshop to continue those relationships in the community that can actually build the awareness for the negative impact of healthcare on Indigenous patients and shift that culture? Is there intention to continue those relationships, reach the decision makers to shift the landscape?
Yes, absolutely there is. Particularly where we ran where we've run all of these workshops up at the College of New Caledonia. We've been in meetings, and we are actually trying to we're hosting an exhibition up there where we're inviting deans. the board members, people kind of in charge who are involved in making those decisions to make this more of a, at least if not permanent, a more sustained workshop that affects the healthcare students, health and dental students up at that institution.
The context we've been running the workshop in right now is that the participants in the last few times that we've run it have largely been nursing and dental hygiene students from the College of New Caledonia and Indigenous students also from the College of New Caledonia. So we're bringing people together who are all from the same community, who all run into each other in the halls, in town, and so it's about connecting those people together. And yeah, we're hoping in this summer, the entire executive leadership team at the College of New Caledonia has asked us to come back and run the workshop for their team and talk about decolonizing education.
So Megan, I've got one more question here. Is that all right, Megan? Yeah, all right.
Thanks. That was really wonderful. As a white settler myself, when working with elders in our community, one of the things we learned around doing dialogue circles and this kind of relational practice is preparing people to be ready to be in the room. So I'm just curious what you're doing with your students in order to, your non-Indigenous students, in order to be able to help them understand the history of Indigenous people before they come into circle with Indigenous people, because we have learned that maybe that is an important first step before so that you can create a culturally safe space. Just curious about what your thinking is around that.
It's an excellent question and one that we've thought about a lot, especially as bringing students in who are kind of new to the context in which, dental hygiene, they're focused in that context and maybe not as aware as someone working in the field for 20 years about the interconnections of Indigenous people in their workplace. And so when we ran the workshop online, we were like, oh, how do we prepare people? We're so kind of not connected in our own community and can't have a chance to connect. And we ran a bit of an orientation beforehand to share kind of readings and things of an expectation that people would read a few things before they showed up. And then we thought about it again for the in-person one. We're like, oh, do we run another orientation? And we realized just sharing content for them to review beforehand and knowing, as our team, having a knowingness and awareness that people are showing up from different points in that kind of learning journey, and just being welcoming to that idea and aware of that beforehand, and making sure that our team knows that, and people are kind of making mistakes in the moment, but just kind of looking forward to learning through that experience rather than shaming people for not knowing something, and kind of allowing for that emergence to happen during the session. So an interesting thing that happened in our most recent in-person workshop was we had the sharing circle, where often it's quite emotional and there's a lot that's shared and deep stories, and most of the Indigenous members had deep-rooted stories to share, and we were wondering, are the dental students, what are they going to share? And we gave them an opportunity to say something or pass if they didn't, so it didn't feel like a forced, I have to equate my story to something that was shared. And the non-Indigenous people on our team recognized that there's no way of equating that, and so to try to do that is almost disrespectful in some ways. So we allowed people to kind of come in as they were, and we were surprised actually how many of the students, they all ended up saying something and almost being more honest than they thought they were going to be even 2 minutes before. The amount of people that said, oh, I wasn't going to say anything, but now I just feel empowered to share, as everyone's being so vulnerable in their own ways. So I think there's an expectation to, I guess, go back to your question of what do you share beforehand, but there's also this power of just creating a sense of vulnerability and comfort in the moment, that people, it comes to them in the moment how they want to show up, and that sense of vulnerability, I think, is what creates community.
I would just add to that too, that the workshop is 2.5 days, and we start with the half day on the Friday evening. So that's a little bit of an easing into what the experience is going to be like. And there's Brenda Crabtree, who's our leader from Emily Carr. She starts the day by talking about sort of some of those hard-hitting facts and the state of Indigenous racism in healthcare right now. So it kind of starts with a little bit more of knowledge holders sharing, and the sharing circle on the first day is a little bit more just kind of introductory, and then that really primes people, and Saturday morning seems to just be more intense than even we expect, even though we expect it every time. Thank you.
Alrighty, so hello, good afternoon all. I would first like to start off by respectfully acknowledging that we are gathered with you today on the ancestral and traditional territory of the Coast Salish peoples, including the territories of Musqueam, Squamish, and Tsleil-Waututh nations. Let's go through here. So I want to start off by saying we have nothing to disclose. And allow me to introduce my wonderful colleagues standing up here with me today. We have Parm Poonia with First Nations Health Authority, and Pamela Naymark with Indigenous Services Canada, and of course myself, Erin Duncan, a proud member of the Haida Nation, Raven Clan, and here representing Simpcw Health Program. So we are here to discuss our evaluation process, First Nations perspectives on accreditation and quality improvement. So what that means is our experiences, the impacts, and lessons learned along the way. So what motivated us about this, our evaluation process? We would like to draw your attention to our purpose, passion, and the three perspectives we are bringing to this collaborative work between Indigenous Services Canada, First Nations Health Authority, and First Nations community across Canada, including Simpcw First Nations, who I work with today. So our purpose is to strengthen quality health services and culturally safe care for and by First Nations community health, wellness, and healing services. And our passion is in creating opportunity to engage and gather the voices and lived experiences of Indigenous communities, knowledge keepers, and leaders who are championing Indigenous-led quality. So, from personal experience, as someone relatively new to the accreditation process, it can often sometimes feel like we are trying to fit a square peg, which is the more westernized colonial approach, into a round hole, that of a more holistically based Indigenous community. That said, I've seen it become a powerful tool for leveraging safety, quality, and accountability initiatives. Finding a harmonious marriage between those two approaches can be a complex but highly rewarding endeavor. It has increasingly become apparent to me of the importance of supporting health-based community development through a holistic, strength-based, and community-led process. And it is something that we at Simpcw First Nations Health Program are constantly striving to incorporate within our quality improvement planning and program development. We are devoted to presenting a welcoming and culturally safe environment with our staff, many who are Indigenous themselves, as well as emphasizing our efforts towards client engagement and patient advocacy.
So in October of 2013, 203 BC First Nations reclaimed their health and their wellness in terms of their direction, their outcomes, and their journeys, and returning it to and by BC First Nations. So for FNHA, for the last 2.5 years, we've been holding a space with our First Nations colleagues across all of BC to really understand, for them to understand and define and lead what quality and quality improvement looks like for them. And for BC First Nations, quality is rooted in culture. It's led by First Nations ways of knowing, being, and doing. And part of that work was really to look at what would be a more relevant, responsive, and respectful approach. And so we are kind of doing the soft launch of this logo that you see, which is the First Nations perspective on quality. And you are actually the first people to see this outside of the working group and our First Nations partners. So I'm super happy about that, and so are our colleagues. So the motto for the group is Indigenous teachings, lead Indigenous practices. So part of this work also for FNHA is what is our perspective on that? We're working with community, they are articulating that. How do we support that? And our articulation is this: quality from a First Nations perspective is both the process and outcome of relationships. In this way, quality is ceremony. Our shared connection and traditional protocols nurture our relational accountability. We will continuously improve so that future generations are the beneficiaries of our transformative efforts.
So what does quality look like at Indigenous Services Canada? Supporting access to high-quality health services is a key objective for the First Nations and Inuit Health Branch. For those that are not familiar, FNIB is now part of Indigenous Services Canada. Since 2017, it's been its own department removed from Health Canada. Since 1999, FNIB has supported the accreditation of health services as one approach to improve the quality of First Nations and Inuit health services, to increase First Nations management of health services, and improve overall alignment with provincial health services. Depicted here are our quality dimensions from the FNIB Quality Improvement Policy Framework. They guide our ongoing efforts to strive for excellence through continuous quality improvement. Now, I thought it was the green button. So we thought we'd share for you very, very briefly a little bit about our approach and design to this joint evaluation process. We wanted to know, without being too constrictive, in the following key areas: to what extent does accreditation and continuous quality improvement address for First Nations self-determination in healthcare, quality of care, client safety, impact on continuity of care, and improved health outcomes. We engaged Reciprocal Consulting, an Indigenous-owned firm that's actually based here in Vancouver, to go about a national and BC-focused evaluation over a 6-month period of time. The evaluation was conducted in various ways. Feedback was received through various means, whatever truly worked for people. So it was either a one-on-one interview, group interviews, electronic surveys, and we also ensured there was some very in-depth case studies. Very important to us as well was to showcase wise and leading practices throughout the findings. And we had a total of about 140 respondents included in both reports. So what's working with the accreditation process and program and outputs? From both reports here, you'll see some highlighted benefits as experienced by accredited organizations. These findings demonstrate change and increased positive outcomes in these themed areas: enhancements in services, in community, with staff, and with organizational partners. We really encourage you to read through both reports to hear more amazing stories and accounts and the diversity of responses. But what we have here is one quote where somebody is sharing how accreditation has strengthened their organizational capacity to respond to COVID-19. I was surprised at how we came prepared to address COVID-19 by having gone through a rigorous process of developing a pandemic plan. Then when COVID-19 hit, guess what? It's here. That work was a benefit. Having solid policies in place has allowed us to deal with the pandemic in a more efficient and safer way. From both reports, what we have here now are some highlighted opportunities for improvement as experienced by accredited organizations, and we've put them into some key themes here. We have an individual and collective opportunity here to identify, using these reports to address what's not working and how to better meet First Nations community health-based needs, values, priorities, and wellness outcomes. They offer a real opportunity to more meaningfully co-involve and co-evolve accreditation programs and processes, ones that are also informed and directed by and for First Nations.
This quote here that we've included speaks to some of the challenges of staff shortages and pay equity, potentially a disconnect with achieving a high level of quality within an organization, but struggling to sustain that level due to limited resources. A lot of questions look at client impact and process impact, but the impact on staff is an important lens because staff turnover and hiring and retaining staff is a running theme. I'm going to turn it over to my colleague. Yeah.
So now you might be wondering, how can you create the change you want to see and be a part of? First Nations have always been upholding dignity, care, and safety for their kin and communities. They didn't, and most still don't, do the health and healing work within accreditation standards and QCI processes. Yes, we acknowledge these processes offer some positive impacts, but we have also learned that there are things that just don't work. These current healthcare and health system realities are stepping stones to future wanted states. Let's walk through some comparatives together. I want you to reflect on what your role is or could be in supporting quality and safe care that is more responsive, relevant, and respectful when working with First Nations colleagues, communities, and clients. So first, LENS is often an invitation to First Nations communities to join an existing idea or initiative. They are sometimes an afterthought, addition, or consulting requirement versus having them to start, igniting, and growing things together. It's time to drop feelings of tokenism and invite self-determination. Colonial language and clinical processes need to acknowledge and make room for more First Nation ways of knowing and doing. Third, move from transactional relating to more reciprocal relating. Exchange currencies of transaction with relational responsibility, shared intentions, and commitments. 4 is moving away from crisis response and band-aid solutions and make room for preventative measures that include sacred knowledge keepers, traditional medicine, and healing.
I think our minute was up a minute ago, so I'm going to go real fast. Logic models, tired of them. They're not always logical, and they're not always welcomed. So is there a way to lean into more interconnected ways, as Gracie had mentioned as well, that's based in land, culture, ceremony, bring back Indigenous ways of knowing and doing? We've talked about co-design. Carly mentioned that as well. And so with co-design, to me, that's collaboration, consensus, collage, that's a bunch of other things, but what are some two-eyed seeing and Indigenous indicators of health and wellness? Patient, super narrow title and often offensive to the individual. The person is more than a patient when they're receiving care, especially culturally safe care. Experts, they can be great, but how about peer-based mentorship? Big L, small L, leadership voice and visibility for everybody. Be hard on systems, be soft on people. We're exhausted and we're strained, but we need to pause. We need to reflect. We've heard a lot about reflection today as well. The last thing is innovation and enthusiasm. I think that's one way to interrupt and disrupt status quo. Is that you? Could that be you? Will that be you? And to tie into some of the things from our previous colleagues, storytelling, making, creating, bravery, heart. We don't want to return to 2020, but I think if we went back to 1820, there'd be some great lessons that we've forgotten along the way. Thank you.
Any questions?
No, I thought we were out of time, so we went real quick. I've now abandoned all my notes. So.
Hi there. It's Marilyn. You know me.
I do know you,
Yeah.
the lovely Marilyn. Hello.
Well, I've noticed in your work, like you try to, collaborate the traditional, and I'm wondering how do you do the clinical and traditional model? And, because we come up with those questions quite often, like in our work, they say, well, how do you measure spirituality and all? I mean, these are people from my age, but we work with, so, and I'm thinking, okay, and how? So, is there a correlation between, like some things that we do ceremonial and the lessened addiction model? I'm just wondering, do you have those balances? I'm just wondering.
Either of you want to take that? I don't know if you want to speak from the community health center perspective in terms of doing clinical work and cultural work.
Put me on the spot here. Sorry, the question was, how do you measure? Quantifiably, yeah, it isn't necessarily measurements towards, it's more incorporating into a culturally safe environment. We do have opening prayers. To some people, we do smudges actually quite often, sometimes daily when we're having stresses. We really try and hyper-focus towards incorporating our individuality and what makes us our medicines, what creates a safe space. As far as measuring spirituality, there isn't necessarily one, but we want to make sure we have, client satisfaction surveys going out, staff satisfaction surveys. What can we do to enhance this, the services we are providing for you? Is there anything else? If they want to see more spirituality, that is something that we're looking into, is something that continually comes up within our community, is more language, more culture. So we're really sitting down. We just had our community health needs assessment come through. We had our results come in, and that was one of our higher ranking things. So we're really sitting down and within our strategic planning, deciding what that means. And actually, we're going to follow up with more in-depth questions. But we do have a specific, quite recently, within I think the last 5 years, we've developed our own language and culture department that focuses in that. And we have knowledge keepers come in and influence. We have a school in our First Nations community in Simpcw. So we have an elders program, so we're really trying to holistically include everything, and we really, really are hyper-focusing towards on-the-land healing right now, too, which is in part spirituality for that community. So again, it's not so much quantifiable as like 1 to 10, but we really want to make sure we're kind of like really hitting that aspect in all aspects, hitting that specific in all aspects within our care, and if we can do any sort of improvements. Sure.
Just wait for the mic, please.
Thank you. Hi, everyone. My name is Cassie Michelle. A comment about the quantifying spiritual. I think what we've seen and what many of us probably in this room already know is that methodologies don't reflect Indigenous knowledge and ways of being and knowing, and we need to have systems that reflect that and don't necessarily need numbers and statistics to match that. We need systems to change to reflect our actual needs. But it's very difficult when we don't have Indigenous leaders within all organizations that are able to understand and interpret that information. Mm-hmm. That's all. Thanks.
Just to add to that, in terms of the accreditation program, the assessment process is very much about looking how are you fulfilling the needs, how are you accounting for the needs, like Erin was saying, of the communities, of the people that you serve. So that wouldn't be even part of it. Any of the assessments that an organization would undergo in accreditation, it's really not up to the assessment body to determine how the best approach is to fulfill the needs of the population that you serve, right?
Just wondering, are you driving towards then a fully separate Accreditation Canada equivalent? Like, is that where you're going with this? Is that the big goal? Or I'm just trying to understand where you're leading this to.
I'm walking because they're going to... if it's a yes or no, I'm going to say no. Keith Marshall, who's the president of the First Nations Health Directors Association, is in the room. Maybe. I think that's a possibility. I think where there is room for improvement is that what is a First Nations led way around accreditation and quality improvement. Whether that's an organization, whether that's an accrediting body, whether that's working better with our existing partners because they want to change their way as health system partners. I think there's a really great, fantastic opportunity. And that's a great way to do some much needed reconciliation and restorative work in this area. So y'all are interested, let's talk. Yeah.
Just a final plug to fill out your evaluations for the council, but a big thank you to everyone for being our learning partners in this room. So big hand for yourselves and for our presenters today. Refreshments are in the usual areas.